how we operate here at Root Cause Medical Clinic. We call what we do root cause medicine because it really is all about getting to the underlying cause of why your body's giving you symptoms. If you've heard of functional medicine or had any familiarity with that, that is what we practice. And you know, as doctors, we were discussing the other day because a new doctor had joined the team, and she said, you know, I get kind of spoiled because most people are doing well, and then all of a sudden somebody isn't doing as well, and I feel like uncomfortable and I don't know what to say. And she's a little bit newer to the field of functional medicine, and I was the two doctors that have been here the longest and doing this for almost 30 years. We were discussing the fact that, you know, where did that tenacity come from, where we don't give up? And I think we discussed it and realized the fact that a huge percentage of the time, and we've done a few different studies and surveys of our patients over the years, and it's been an 85% success rate of patients improving on the program. So of course that's very high. I think medicine is more like 15%, traditional conventional medicine of improvement. So 85% is very laudable. It's a very high percentage. So of course we see improvement the vast majority of the time, which makes us realize the program works. And when it doesn't, when someone is not seeing improvement, we know why, meaning a couple of things can be happening. One, someone's not being compliant, whether knowingly not being compliant with what we're asking them to do or unknowingly not being compliant. I recently saw a patient, not really a patient actually, just a gentleman I met while I was traveling, and he has a skin condition, and we were chatting, and I gave him some recommendations, and we talked about sugar content in his diet, and he said, you know, I don't have a sugar tooth. I don't have a sweet tooth because I'm not big on desserts and things like that. And I was like, okay, that's fine. And I said, when you get home, just start like looking at labels before you eat anything. Start looking at labels and see there's some sugar sneaking into your diet, or maybe it's not a big deal for you. And he wrote me an email, and he's like, oh my gosh, there's sugar in everything I eat. I had no idea. So that can happen with patients as well, where it's like they kind of feel like they know what they're doing and not, and then something is sneaking in that they're just not aware of. Or they can just be having trouble sticking with dietary changes and lifestyle changes and knowingly not doing it, but not really wanting to admit that they're not doing it. So there's the compliance factor, whether knowingly or unknowingly. And then beyond that, there's more going on in their body that we have to discover. So another reason we don't give up is that we realize, okay, there's just more here. There's another factor here that we have to look at. And that's what I love about all the functional medicine tests we have at our disposal. I mean, we can look at heavy metals, we can look at Lyme, we can look for parasites and bacteria in the gut. We can look at your genetics, which is fabulous. That's more of a newer addition to our program in the last few years. And there's nothing more personal than your genetics, what you inherited from mom and dad. And that's been a great addition to the practice. So there's always another level we can go. And I think our tenacity comes from the fact that we know if we can hang in there long enough and there's compliance with the patient, that the vast majority of times we can get the job done. So I think especially in our society today, it's like, well, this is the drug for your symptom and didn't work for you. Gee, too bad, are you under stress? Here's another drug, and it's terrible. I think it's awful that that's how we treat our patients, and that conventional medicine does that, gives up very easily on people, kind of puts it off on the patient of like, well, works for everybody else, don't know why it's not working for you, or here's your psychiatric drug because clearly you're under stress. And it's very unfair, not to mention those drugs have such dangerous side effects, but instead of standing back and saying, okay, there's more to this. What is it? So I just kind of wanted to go over with you how we think, because it's successful a huge percentage of the time, and it's having the tools, it's having the thought process of looking at the body as a whole and understanding these bodies heal beautifully, and when they're not, there's a reason, and we, with great tenacity, go over and go after what that reason is. So if your health is not the way you want it to be, and you've been frustrated by sort of, you know, a narrow approach that hasn't really gotten you anywhere, please feel free to reach out. That's why we're here. That's what we do. It's why we come to work every single day, and our success rate is really high. So I would love to help. Give me a call or visit the website, rootcausemedicalclinics.com. And we are a destination clinic, so depending where you live, we can work with you long distance in many cases. So I hope you found this informative, and I'll see you soon.